Thank you very much, Professor Yin, for okay, sorry, I need to start my video. Yeah, thank you very much, Professor Yin, for a very informative and provocative presentation. It definitely resonates with us at different levels, from experience of working with travellers, travel organisations and the health services. So I would now like to look at some of the questions. Overall, a lot of people thanking you for your presentation. Let's see. We could start with, we have one from a service provider here. How can I, as a service provider, mitigate the impact of discrimination on the mental health of travellers within my role, i.e. make my service more traveller user friendly, from your experience?
Yeah, well, I mean, that's the most important step, is that you want to do it, and then you have to build that momentum among other people, your colleagues and the organization. Often it's a matter of really just engaging with travelers in this case, and asking them what's working for them, what's not working, and how can you collaborate to change and improve any sort of processes and system agility to provide better services. So it's that work of understanding your own implicit biases, if you have any, but also how the system may be improved to work with particular groups better. And often the most important step that I've noticed in Australia anyway is that that respectful, humble, wise sort of engagement. And long term, that leads to people having more say over their local health services and more input into how those work on an ongoing basis, that can improve the culture of those organisations and better, I guess, resonate with the cultures of traveller peoples within that area.
Yeah, thank you. I mean, I think we are dealing with issues of still maybe ethnic denial, and I think you talked about data there, and a few people have mentioned that our issue is we don't have an ethnic identifier, so it's still a challenge, which is why the study was done, to be able to disaggregate data. So it's very hard to monitor access, participation, and outcome to mental health services for travellers. So that is a current challenge. It is something that has been recommended, it's been worked on, but it's taking a while. So it is a challenge to deliver that, and a few people have mentioned that in their questions. People, thank you for a very well-rounded presentation. Another question here: from your experience, can you offer insights about addressing, in partnership with them, the racism embedded in health institutions and responses?
Embedded in what institutions?
Well, embedded in health, within the health institutions.
Health. In health institutions, yeah. Well,
yes.
Yes, there's a lot of that. There's a lot of that embedding, and I think fortunately that we do have these frameworks that people have developed specifically to work with healthcare institutions, and it's just a lot of work, and it's the sort of work where you can take 2 steps forward and 1 step back. You do have to have strong buy-in from leadership in organizations, and sometimes that buy-in can disappear with people leaving and so forth. So the champions, you want to multiply the champions, and you want to try and embed something to start with as a sort of seed that can grow into sort of more anti-racist interventions and efforts. So yeah, form your stakeholder groups, form your affinity groups, get your action groups going. It's a collaborative. You can't do this work by yourself. You need help. You need a community of practice, and you need to start with simple audits. What data is available? Is there any way to get? I mean, those identifiers you talked of are so important, and we did a lot of advocacy in Australia to get Indigenous identifiers in health collections, and to assess the quality of those and to improve the quality of those identifiers. So without data, there's no problem, and no one will see that problem. And so you step up from the knowing to the monitoring to the intervening, and then assessing, and start small and grow small wins, and then grow to something larger. So some of the work in Australia started in just one department of healthcare, a local authority, and then grew from there with that work. So yeah, it's challenging work, and don't expect to get it all done anytime soon, would be my advice.
Yes, yes, no, we have been 20 years in the process of trying to roll out an ethnic identifier, so it's been a long process. But you're right, and the services that use it, like we've the Health Research Board in terms of addiction, and that's been very useful because it's provided a lot of data. And I think often there's a fear of an identifier that expose racism rather than saying it's about improving the quality, access, participation, effectiveness, and efficiency of the service, really. Now we've one from a younger traveller who's saying, as a young traveller, how could we build up our community resilience to challenge the determinants of mental health and suicide in their community, based on your experience?
Yeah, that's a good question. I think there's the evidence really in terms of responding to racism is that, once again, it's not something you want to try and do at an individual level. So there are the most beneficial individual responses to racism are really social support seeking. So how can you get support, physical, instrumental, emotional support from your communities to deal with racism when it happens? And then what sort of coalitions can you build, with others in society? Because as targets of racism, I mean, you're by definition, you're in a disempowered situation. And so the anti-racism work is deeply coalitional work, I think. And so there's advocacy at so many levels that I think is required, from with service providers to what are the redresses, the legal redresses for anti-discrimination, what is the opportunities to raise awareness in the media, to create a sense of the value of a society where racism is not prominent. So there's a great deal of value in cultural diversity to societies, but it's not realized when we have these levels of racism. So we've done some work on, for example, the economic cost of racism as a form of advocacy to help people understand why it's important to address racism from an economic perspective as well as a political and social perspective. So yeah, it's not really anything that you probably don't know already in that sense. But yeah, I guess the important thing is to be able to cope with that sort of with racism as a community, as well as when you have energy and time and are able to try and sort of push back against that in various ways that really draw on allies and advocacy in your communities and society. And that's pretty much the sort of work that we've done in Australia, and managed to get racism on the agenda of a number of national peak bodies and activities of government that then provide that funding and that monitoring and that accountability in terms of how that's progressing in society.
Yeah, because I think from our point of view, and there is, I say, just trying to link a few questions, that issue you spoke about, a bit like the avoidance, and we'd say maybe internalizing some of that discrimination, which is often then causing issues in relation to addiction, internal violence in the community, and it then leading to a higher level of smoking, which affects then in turn heart disease, respiratory conditions, and then health providers saying, well, you're causing your own ill health by your behavior. So it is that thing about, particularly for young people and their identity, to feel proud of who they are, and it's difficult if they experience racism, and I think that's leading to some of this behavior. And I can understand the questioner being concerned about how do you build that up within the community to be strong.
I mean, that sort of internalized, the externalizing of racism is kind of the most important thing. It's not to bottle it up, not to self-blame. And we in Australia have a lot of problems with internalized racism and what we call lateral violence. So the violence within the Aboriginal community that's created by people internalizing colonial ideas and inflicting that on their own family and community members in relation to ideas of identity, ideas of what it means to really be an Aboriginal person. So ideas of authenticity, all of this comes up and ends up kind of doing the work of colonial racist
Yes.
discourses within our own community. So that's definitely I didn't mention that, but that's a big problem in Australia that we're grappling with. How do we be supportive within our communities and then be able to then outwardly face towards racism rather than letting it infiltrate within our society? Yeah.
Which is a challenge. Sorry, there's lots of questions coming in. Does Yin have any thoughts, examples on successful initiatives to create a sense of inclusion and closeness between minority ethnic peoples and the dominant mainstream culture?
Yeah, well, I mean, the evidence for that sort of work is really the strongest evidence is something that's called the contact hypothesis, which is really just a matter of creating contexts or situations where people of different groups, minority and majority groups, for example, can interact in positive ways. And so the contact hypothesis is about cooperative engagement, a sort of equalizing of power, potential for friendship as part of it, but basically getting involved in common activities with common goals where there's an ability to do so without strong hierarchies between, say, majority and minority groups. And so the contact hypothesis has been studied, hundreds of studies, and you can do this sort of thing in workplaces or schools, a lot of work in schools and workplaces. Pre-existing groups, which means, of course, that you need to also have integrated spheres of life where people can come into contact. And then you set up those conditions, and that leads to reductions in prejudice and better relations between those groups. There's some subtleties where it can go wrong, but generally those are very effective, and particularly effective actually for people who